Hello, Mrs. Mongat. My name is Baldesh Rai. I'm the dietitian who's going to be your main contact for the next 12 months. How are you?
Oh, yeah, I'm good.
Right. Do you know why you're here?
Yes. The nurse, I had my weight taken, and I'm overweight, and she said that it could cause problems if I didn't do something about it.
Right.
So that's why I'm here.
Okay. Well, basically, being overweight is actually a risk factor for a lot of long-term health conditions, including type 2 diabetes and heart disease, amongst many others. But the good news is that losing weight can actually reduce a lot of our risks. So basically, many of the cases of type 2 diabetes can be prevented through following a healthy lifestyle program. And hence your invitation to this study.
Okay.
When we say a healthy lifestyle program, what we're talking about basically is maintaining a healthy weight and eating a healthy diet which is low in fat, high in fiber, with lots of fruit and vegetables, and increasing physical activity or doing physical activity is one of the best ways of reducing that risk. Okay.
Yeah.
I don't know if the nurse explained that this is a 12-month program.
Yes, she did.
Okay,
She did.
during which there are going to be 22 contacts with myself.
Okay.
And 9 of these are going to be one-to-one, so face-to-face, sorry, not one-to-one. 9 will be face-to-face, 13 will be telephone contacts.
Okay.
Now, during these contacts, we will be discussing many aspects of your eating behavior as well as physical activity. And then together, we'll develop a plan to improve your lifestyle.
All right.
Right?
Okay.
I'm going to be there from a professional point of view, but I would strongly encourage you to bring along a member of the family, particularly if there might be a main cook of the family or somebody who may need to lose weight as well.
Right.
They would be more than welcome, and we'd be helping them along as well together with yourself.
Okay.
What will happen is at each visit, you set your personal goals. So every visit, you set your own personal goals, but I will be there to help and support for you to achieve these goals throughout the program. So every step of the way, I'm going to be there.
Right.
But the reason I mention the family is because obviously I'll be there as a health professional, but family support is always very useful. And the good thing is at the end of the year, you and your family will be fully equipped with the skills and knowledge you're going to need for a healthy lifestyle for the rest of your life.
Okay. Right.
Yeah?
Yeah.
Okay, so there's a bit of introduction on that.
Yeah.
Basically, at every visit, you'll get given a participant booklet. Now, the booklet really is there to reinforce what we discuss at clinics. So it's really a reference point for you, and also it'll have your measurements there. So basically your weight, the goals, and so on. But it's there for you, for you to take home, for you to read, to refer back to, as and when you feel necessary. Basically, as I explained about being overweight is a risk for many issues, and this is part of your booklet. So it's just actually telling you the kind of things that can happen in terms of carrying extra weight, but this is referring mainly to type 2 diabetes. Do you know anything about diabetes?
Not much, no.
Well, type 2 diabetes is very much a South Asian kind of, almost like an epidemic. Do you know anybody in the family who's diabetic?
My granddad, but he's not alive anymore, so I know we have had diabetes in the family, and I know my dad is very conscious, or always has been, because of his
in
dad.
The family, right.
And although I know about it, I've never done anything about it or ever really thought about it.
Right.
And I know when I was pregnant, I had what I was told was pregnancy diabetes.
Okay, so gestational.
Yeah,
right,
but that was it, and it was all fine afterwards. So that's the only dealings I've had with it.
Yeah, well, all the more reason, because having had if it was gestational diabetes, it's really important to try and keep an eye on the weight, because our weight and waistline can make us more predisposed to type 2 diabetes. And if you already were at that borderline during pregnancy, there's a chance that it might show itself in years to come. But if you can take control of the weight now, you can reduce that risk. hence the importance. And what you have to remember here is we're not just talking about high sugars, which is what diabetes is all about, but it's just when the sugars are there for a long time, they can lead to a lot of sort of serious complications. So we're looking at things like eye damage, in terms of high risk of strokes, kidney damage, nerve problems and so on. So what we're trying to do in this diet intervention program is to try and help reach the target of weight loss so that you're reducing your risk. So that the targets are both weight loss and increasing physical activity. So this is the program goals.
All right.
Okay. We're going to do some measurements later on. But I mean, losing weight is not easy.
No.
But if we know the reasons why you've gained weight, that can be really helpful in tackling weight loss. So what I would like to find out from you is, can you think of the reasons why you've gained the weight?
I think mainly it's lack of exercise.
Okay.
Or regular exercise. I have phases where I'll go to the gym or I'll walk to work for weeks at a time, and then I'll just stop for some reason, and then I won't. It takes me ages to go back again, and so I think mainly it's the exercise, and I think because I've got 3 boys, teenage boys, it's just cooking healthily and eating healthily, because they're meat eaters, so it's always meat and so on, and I guess the fast food, because we do have fast food, probably more than we should. Although I don't have much of it, I still have it. So I think it's a number of things like that. And I don't have much willpower, and I think my habits are not good in terms of what I eat when I eat, I think.
Okay.
Because I've been doing the same thing for so long, that must be one of the reasons.
Okay. When did the weight gain?
It's been like slowly, I suppose, over the years.
How old are your boys?
Eldest is 22, then 19 and 16.
Okay, and they're all at home?
2 are at home, one's at uni. One's back from uni, one's...
Right. And who does the main cooking?
Me, I do it.
Okay. Right. Okay, so main reasons for weight gain, if we just go through them again. One is you feel you lack the motivation or the willpower.
Yeah.
Secondly is, or not in any particular order, but lack of exercise you feel is another thing. And fast food in terms of perhaps having it when more often than perhaps you should. Okay. So let's just give us some idea as to what we need to be working with as we go through the program, because the whole point of this program is it needs to suit you as an individual. I'm not here to dictate.
No.
I'm here to work with you. So the idea is we need to work out a plan that's going to suit you with your boys, with your lifestyle, with the family. So there's not big changes, just small changes. You said you're overweight, or the nurse has said you're overweight, but I just need to find out what stage you're at mentally to make the changes. So the next few questions are very much related to find out what stage you're at personally as an individual. So here, this is your booklet. So this is you're going to be taking this away with you.
Yep.
So there's a question here which says, how important is it for you to lose weight in the next 6 months? So it says, please mark from 1 to 10. 1, not important at all. And as you go across, up to 10 being very important. So where would you put yourself at this point in time?
I think it is important because
so do you think...
It's my age. I reckon about 8, 7 or 8, I think.
Okay,
so
I
would probably circle it
7?
over there. Yeah.
Right, so it's important.
Yeah.
Okay. Why are you at 7 at the moment and not 10?
I guess because it's never really been an issue for me if I've been overweight or not.
It's never bothered you?
It's never bothered me. But I think as I'm getting older, and I'm turning 50 this year, I think I need to do something.
Okay.
Because from what I've heard, when you go through the menopause and stuff, people do put on weight, and if I'm already overweight, then I'm going to put on even more weight. So I guess things like that, I'm thinking now is the time I should try and do something about it. So yeah, I think,
Okay.
you know, but I don't, it's not something that I've ever lost sleep over or got really
Okay.
hung up about.
All right. It's never bothered
It's
you.
never bothered me.
Okay. So moving from 7 to 10, that's the next question, is what would it take to move you up a couple of points?
Wow. I guess if I had a bit of a scare, you know, if somebody said to me, right, you're really high risk with your health,
Okay.
I think that would really make me shift up. But I don't think there would be much.
Well, you're
much
quite
more.
close to the very important bit
Well, yeah,
anyway,
yeah,
so you're
yeah.
almost there. Okay.
Yeah.
Okay, again, very similar question to previous one, but this one's to do with all confidence. So at the moment, how confident are you that you can lose weight in the next 6 months?
About 4, I reckon. I just know me. I'll lose a few pounds and then I'll put it back on again.
Okay, so at the moment that you think it's
yeah,
4, right?
Yeah.
So the next one, actually, you've almost
Yeah.
answered that. It says, why are you at 4 and not at,
Yeah.
I should say, 8? So it's because you don't have,
I don't have the willpower.
right.
It's as simple as that.
So what would it take to move you up a couple of points?
I'd just have to have the willpower. I'd have to just get on with it, and you know.
How do you think you'll get the
I think I'll get the willpower by support, obviously. The encouragement that yes, you're doing well, and sometimes that's quite hard in my household with like
Boys.
4 men because they just don't. It's just not the thing. They
No.
just don't. So I think the phone calls that you mentioned earlier, I think that would help.
Do you think it would be useful, from your point of view, to bring either one of your boys or your husband?
Possibly, yeah. Yes, I think it would. I think it would. But I mean, I think if they see me lose weight, I think they would be supportive. But they're so used to me saying, "Right, I'm going to stop my diet. I'm going to go to the gym," and then I don't see it through. So
Okay.
they've actually, it's just mum going off on one. It's one of those things now.
Right. So from the confidence point, the next question is, what would be a good first step in terms of, you know, because you've said you're lacking willpower. So I think you've more or less answered that, but we can go through what would it be the first good step?
I think first good step would be for me to lose a few pounds, just because I know how good you feel when you can fit into something a bit more comfortably, or and that's like I said before, I'm not really conscious of how much I weigh, but I can feel it if I put on weight rather than look at the scales.
Right.
And I think that's a good way to get me motivated, is I can put things on for work and think, I feel much better in this than I did 2 weeks ago or whatever.
Okay. What obstacles do you foresee and how much you deal with them?
Obstacles. There shouldn't really be very many obstacles, to be honest. I use obstacles as an excuse, but I don't think, I've got no small children, or I don't work particularly long hours. I've got everything at my doorstep, so it's not as if I have to go very far. So I can't think of any
Okay, that's fine.
like major obstacles.
Okay, and then another bit just to do with the stages of change is, this is all to do with motivation. So try to identify 3 reasons why you want to try and lose some weight.
Okay, 3 reasons.
3 reasons, yeah.
Because I don't feel good in my clothes. I know I've put on weight, and my work clothes feel uncomfortable. So I would like to feel better about myself.
Okay.
And to me, that's losing, not a huge amount of weight, but
No.
enough to make me feel better. So that's one reason.
Mm-hmm.
Second reason, as I said, I'm turning 50 this year, so I would like to look a bit younger, and I think I will if I lose some weight. So that's a bit of a motivation.
Mm-hmm.
And I think the third one, which I suppose should be the first one, is the health, I think.
Okay, right.
But, I have touched wood being a very healthy person, so I don't think about the health
Yeah,
issues,
sure,
really.
Sure, okay.
But I should.
Okay, now the reason for asking you these sort of questions is you need to remind yourself of these when you're finding it difficult, so that, once you go away from here,
Yeah.
come sort of 5 days down, down the
Yeah.
line, you think, you know, to know what's the point of this diet,
Yeah.
it's good to refer back to
Yeah.
this, because these are the ones will keep reminding you as to the reasons why you are where you're at, and the confidence score, the motivation. So these are just guidelines that's going to help you on that.